Hi, welcome to Infusion Health, the podcast. I'm comedian Chris Patrick, a.k.a. Self-Proclaimed Power Man. And I'm here with my co-host and significant other, Rach.
Hey, guys.
Now, today we have a show. He's calling from Jacksonville, Florida. His name is Mitchell Yass. And he's a doctor of physical therapy. He's going to talk to us about chronic pain and muscle exercise. Mitchell, welcome to the show.
Thank you for having me. It's great to be with you.
Now, just recently watching your video, misdiagnosis, and you're talking about knee pain and stuff. But can you tell the listeners exactly some of the stuff you do and what you work with?
Sure. So you really want to kind of understand the general principle by which pain is diagnosed, which primarily globally is the MRI. Typically, someone has pain somewhere. An MRI is taken, a structural variation like a herniated disc, a stenosis, or in the case of the knee, a meniscal tear is identified. Mm-hmm. Since it's identified at the time of pain, it is asserted to be the cause of pain. This is a concept called correlative theory, which is junk science. There's no basis for that. I developed a method that allows me to interpret the symptoms being presented to identify what tissue, in effect, is creating those symptoms. And in more than 98% of cases, I've shown the cause to be muscle.
Okay, so how did you develop the system?
So strangely enough, it happened right at the inception when I was becoming a physical therapist. I'm now, after you're in the part where you're studying and you're in the lecture concept, now you're actually going to apply what you've learned to people. And so for the first time, you have people in front of you. And so let's say we talk about the knee, someone saying that they have pain around their kneecap, and they present to me with a MRI showing that they had a meniscal tear. Mm-hmm. So the meniscal tear, if it were to create pain because it's located between the thigh bone and lower leg bone, would create pain on the side of the knee. Mm-hmm. But the person's having pain around the kneecap, and what you'd recognize is that's actually a separate joint, the joint between the kneecap and the thigh bone. So it became apparent to me that the meniscus could not create pain around the kneecap. So I went on to say, well, what could cause pain around the kneecap? And it turns out if your front thigh muscle, which is attached, is too strong in comparison to your hamstring posterior thigh muscle, it can tighten and pull excessively on the kneecap. So when you bend your knee, the kneecap becomes compressed and creates pain. So all I did was I stretched the quad, strengthened the hamstring, and within a treatment or two treatments, the person was pain-free. Okay. I knew I had come on to something, and so I then continued to follow the process to explain it everywhere in the body.
Okay, so if somebody like, okay, I got this knee pain or something like that, I go to my doctor. Doctor does an MRI, looks at it, and says, okay, you're going to need surgery. You're saying that's wrong? Are you saying they do need surgery? They don't need surgery? Or the pain is coming from somewhere else, and they may want to avoid surgery?
So what I'm saying is that you cannot use the MRI as the primary mechanism for diagnosing, because what's being found may have existed for years, if not decades, prior to the advent of your symptom. Just remember, always remember, the MRI is performed for the very first time in the area at the time of pain, right? So that's why the meniscus or the arthritis or the pinched nerve is found at that time. But my question to you would be, well, what if an MRI was taken a month, 2 months, 6 months, or a year prior? Would that structural variation have existed? The answer is irrefutably true. You know that because the first study was done on people who did not have back pain in 1994, and 70% were found to have bulging or herniated discs.
So bulging or herniated disc, is that in the lower back?
Yeah, that's in the spine. When a disc shifts from the center point to the outer portion within the spinal column, that's called a bulge. When that shift goes outside the outer border of the spinal column, that's when it's called herniated.
Because I remember one time a few years ago, and the sad thing was it happened around my birthday. I was working at work. What I do, I'm a custodian, and I was working, and all of a sudden I just had to sit down. So I sat down. I tried to continue work. I couldn't continue work, and my lower back was just killing me. And I just said, I gotta go. I gotta go home. So I went home. Went to the doctor the next day. He gave me some Vicodin, not a strong dose of Vicodin, but some Vicodin. And I was just basically, I just sat around for 3 or 4 days. And if you know me, I like to move. So it was hard. But then after about a week or so, I got better. I was able to go back to work. And I was working fine. And then, but about every hour I had to sit down for like 5 minutes. And then it got to be like every 2 hours. And, I've been fine ever since.
Right. But let's look at specifically what you just described.
Mm-hmm.
You just said that your symptom is brought on by an activity.
Yeah.
So what you find is in the vast majority of anyone suffering from pain, they'll say that their pain comes on when they sit, if they sit too long, stand, bend, twist, reach, kneel, walk, go up a flight of stairs, anything of that nature, right?
Mm-hmm.
So you're connecting your symptom to an activity. What tissue is responsible for activity? Is it your disc? Is it arthritis? No, it's muscle.
Yeah.
So once you connect your symptom to activity, by definition, you've identified the fact that it's probably a muscle that's creating your symptom. Secondarily, if in fact arthritis, a pinched nerve, or these are structural variations that exist.
Yeah.
If they were to cause pain, wouldn't they cause pain basically on a continuous basis because they exist? They're not disappearing. They're not coming and going, coming and going. So if someone had a structural variation creating symptom, you'd expect continuous pain.
Mm-hmm.
But the person doesn't complain of continuous pain. They talk about if they're upright, if they're standing, moving, they have pain. But then as soon as they sit down or lay down, the pain goes away. Yeah. Well, again, doesn't that sound more like that would be something that relates to a muscle, which when used creates pain, but when rest goes away?
Mm-hmm. Well, I'm not big
right?
on the. Well, the muscles in the back, I know the upper muscles because I do exercise, I do work out. You got your trapezius muscles. Those are under the delts in the back. But what are the lower back muscles?
Well, this is another big point, and so the idea is people have been so if people get back pain, they're told, "Oh, you need to strengthen your back." It's actually not that. That's exactly the opposite of what you want to do. What you want to understand is that there is a relationship between your lower back muscles and the relationship between your front thigh muscles and back thigh muscles.
Mm-hmm.
So if the front thigh muscle quadricep is stronger than your back thigh hamstring, it's going to shorten. It's attached to your pelvis at the top. So it's going to pull the pelvis down in the front, which causes excessive arching of the lower back, which then causes the lower back muscles to shorten and strain.
Mm-hmm. So
you don't strengthen. If you strengthen your lower back muscles, you're going to cause them to shorten even further, leading them to be more susceptible to straining. So actually, for the average person, if they stretch their quads and strengthen their hamstrings, the pelvis from the front to back remains level, and that keeps the length of the lower back muscle optimal, allowing it to function without pain. And if you think that this is a possibility, the easiest test is, let's say you're having lower back pain, just stretch your quadricep muscle. If you stretch your quadricep muscle and your lower back pain decreases, you've just described the relationship between your quadricep and your lower back. So now just strengthen your hamstrings and you'll control your lower back pain, stop it from reoccurring.
Well, I noticed that like a couple of years ago, I was having back pain. And I was waking up Saturday, going into the gym and doing a yoga class, and that really, really helped with my back pain.
Right. So again, reinforcing, what is yoga? It's an activity-based type of situation. So what's it addressing? Muscle.
Absolutely.
So the yoga is basically lengthening muscles, allowing them to maintain their optimal length, allowing them to perform optimally, preventing them from straining and eliciting pain. So again, think of this. If you had a herniated disc and that was supposedly the cause of your pain, how would yoga unherniate a herniated disc? Or how would yoga unarthritis arthritis? It can't.
For myself, I had a neuropathy brought into my leg because I had a varicose vein surgery. And so I'm in a Facebook group for fibromyalgia and neuropathy. And I see this question time and time again. What is the number one thing I can do besides medication to help myself? And it's exercise.
Yeah. So here's a big thing. This is a tough one. This is a little hard for the person to accept. You went to a neurologist and the neurologist said you have neuropathy.
Yep.
So you kind of see the connection between the diagnosis neuropathy
Yep.
from a neurologist. But if you break the phrase down, neuropathy, it implies a pathology of a nerve,
Yep.
as if there's a structural variation of a nerve. And I'm simply here to tell you that's not how the body works.
Okay.
Individual muscle nerves do not break down.
Okay.
If you could have systemic disease, muscular dystrophy, Guillain-Barré disease, these things, but the average person, a nerve does not break down. It is
Okay.
not the nerve that's the problem. In the vast majority of cases I've seen, including things like sciatica, there is a muscle that's straining,
Sure.
and it then impinges on a nerve that's proximal to it.
Sure.
So you have a muscle strain create a muscular pause create a neurological symptom.
Yep.
So to control the neurological symptom, you have to resolve the muscular deficit.
Totally
That's in
makes
fact
sense.
what sciatica is.
Yep.
Well, sciatica. Now, when you talk about sciatica, just so the listeners know, we're talking about the sciatic nerve, which is located where in the back.
It starts in the gluteal region and ends at the back of the knee.
Mm-hmm. So when you're talking about back pain too, because there's been times when I've had lower back pain and I can feel it all the way down by my quadriceps, my quads, my hamstrings.
Mm-hmm. So one thing, again, what I need people to understand is you can't just make generic, and I'm not talking about you, I'm talking about people who diagnose.
Yeah.
You can't just say back pain. First off, the average person even doesn't know where the lower back ends and the gluteal region begins.
Absolutely.
So I've treated innumerable people who actually have gluteal region pain, and it's being called back pain. That's dangerous because if you consider yourself having lower back pain, you're susceptible to getting an MRI of the lumbar spine. What you have to understand is if your pain is in the gluteal region, it wouldn't matter what structural variation was identified in the lumbar region because no aspect of the lumbar region, spinal cord, or nerve roots innervates the gluteal region.
Mm-hmm.
So it wouldn't matter what you found there. It can't cause gluteal region pain.
Mm-hmm.
When we talk about the gluteal region, in the upper portion of the gluteal region, there's a muscle called the piriformis. In the lower portion of the gluteal region, that's where your hamstring attaches. So you could pull your hamstring, which you think would cause pain behind your leg, and in fact, you may end up with pain in your butt. And as a result of that, that would confuse you because your pain's in your butt. And so you think, well, maybe it's that part of your back. Well, now you're thinking it's back, when in fact, it's actually a hamstring strain. Mm-hmm. But you got to be able to know exactly where the pain begins and where it ends and which potential tissue can create pain in that area.
So when you talk about stretching the hamstrings, should you stretch your hamstrings every day when you wake up, or every couple of hours? You know, if you're at your desk, sit up. You know, I'll put your foot on your desk, stretch your hamstrings, grab your leg, and do that. How often should you stretch your hamstrings?
So as a general rule, this is going to shock people. I would say at least 90% of the population, they might, when they bend forward, they will feel tightness in their hamstring, but that is not an indication of hamstring lack of flexibility. If you want to know if you have hamstring lack of flexibility, you lay on your back, you bend one knee and put that foot on the surface you're laying, and then you raise the other leg or have someone raise it. If it gets to 90 degrees straight up and down, then you have a perfectly flexible hamstring. If it goes beyond that, you have a hyperflexible, too flexible. If it's short of 90 degrees, you have a tight hamstring. Almost in 90% of the population, you will find that they at least go straight up and down or go beyond straight up and down. The reason that you're feeling that your hamstring is tight is because you've lost mobility in your lower back. And so if you would have been forward and you can't reverse the lower back curve from in to hunching, then you have to pick up that range of motion to go down and touch your toes. It gets picked up at the hamstring. So that's why you feel a pull in your hamstring, but it's not that the hamstring's tight. It's actually hyperflexible. You've lost mobility of your lower back. So as a general rule, almost at least 90% of the population, they will find that their quadriceps are tight. And that, in fact, their hamstrings are weak, not shortened, which is what's making the quadriceps tight and making them have lower back pain. So you stretch the quadriceps and strengthen the hamstring.
Yes. and stretching your quadriceps. You do stuff like exercises like, bend over and try to touch your toes, stuff like that. Grabbing your ankle and flexing your hamstring.
So if you want to stretch your quads, the average person, what they do is they stand up, they hold on to something stable, they grab their ankle with one hand, and they try to pull their heel towards their butt behind them.
Mm-hmm.
The only point I would make about that as a stretch of a quad is that typically the person's knee is directly below their hip as they pull their heel towards their butt. To stretch the full aspect of the quadriceps, you need to have your knee 2 to 3 inches behind the hip. Mm-hmm. Then you begin to bring your heel towards your butt, and you'll feel the stretch fairly high on the quad. That's how you know you're getting the full stretch of the quad. That's how most people stretch their quadriceps.
Mm-hmm.
Okay, so we've talked a lot about the back, but we really haven't talked about the chronic pain for those people out there. How many people have you worked with chronic pain?
Somewhere in the 14,000, 15,000 range over 28 years.
Totally figured as much. For people that are getting misdiagnosed out there, what would you tell them is the main point that they really need to pay attention to for the misdiagnosis out there?
I just want to make one really, really critical point about this concept. Chronic pain. At this point, we're 40 years into this issue. By the way, chronic pain started in the late 1980s, early 1990s. It never existed in the history of mankind. There has never been a situation where chronic pain was identified and treated in the history of mankind prior to the late 1980s, early 1990s. And the reason that's important is you have to have a justification, a rationale. Why does that exist? The answer is technology. As a result of technology and automation, people started doing jobs that related to more sitting and started doing less and less physical activity. As a result, their muscles became weaker and more susceptible to straining. This goes across the age gap. Prior to the late 1980s, the average person who suffered from chronic pain was in their retirement years. Now you have people from 20 to 90 suffering from pain. That's the population, but why chronic pain? Why is it chronic? Why is it that you can't get it resolved? Well, muscular causes don't show up on diagnostic tests, and the medical establishment is not designed to, they're not educated or trained to identify muscular causes. So just recognize muscular causes will never be identified. So if you only treat what is identified, herniated disc, stenosis, arthritis, any of these things, then you're going to continue to have muscular deficits, still try to function. The muscles will continue to strain and elicit pain. So that's the reason for chronic pain. Mm-hmm. So if you're having chronic pain, the first thing I would suggest, and this is really more a question of what, I'm not trying to point out a shift in medical mindset. Right. I'm trying to create a shift in logical mindset.
Yep.
Would you acknowledge that if you have had pain and you can't get your pain resolved, isn't it possible that the most logical reason is that the tissue creating the pain is still in distress, creating the pain? Isn't that the logical reason? Versus that you've gotten the exact right diagnosis from day one, and they've given you 30,000 different treatments. You just haven't responded well.
Mm-hmm.
Which one sounds more logical? Yeah. So if you're willing to just jump to that thought process that maybe I just haven't been diagnosed correctly, now you could go on and say, well, what in real life may give me hints that I've been misdiagnosed? Well, I brought up 2 key points. Number one, the first thing to say to yourself, a herniated disc I've been told is causing my pain, or arthritis is causing my pain. Is arthritis always here? Every day, 24 hours a day, do I have arthritis? Yes. They're saying the arthritic process is causing my pain. So shouldn't that mean I should have continuous pain 24 hours a day, never stopping, regardless of position, and it should be fairly constant in its intensity? Yep. Well, if you're not having that, that's a red flag. Yeah. Isn't that a red flag that your symptom doesn't seem to match the tissue that is supposedly creating that symptom?
Yep.
Doesn't that kind of make sense? Secondly, if you start to notice that your symptoms only seem to be exacerbated or brought on by activity and seems to diminish through rest, sitting, or laying, then it's another red flag. How would arthritis only be activated when I stand up or go upstairs or anything, but somehow it unarthritis is when I sit down? Mm. So if you could just take those, that's what I tell everybody. Just look at 2 things. Is your pain constant? Is it variable to position? And does it seem to come on based on activity and go away with resting, sitting, or laying, then you kind of have to jump to the idea that maybe it's muscle and then recognize, well, if it is muscle, I've gone to no one who could diagnose a muscular foot, so maybe that's why I have chronic pain.
Yeah.
Does that make sense?
Yep.
Yeah.
So I got a question for you.
Yes.
Our society is moving into, I see, two different types of people. The people that are in the workforce and the people that are more of our bingers. And unfortunately, I'm seeing a biodynamics similar in both, because we're also moving into more of a computer stance of people, which then you're going into, it doesn't matter if you binge or if you're consistently in front of a computer, because you're not getting up and being mobile.
You've hit exactly on the point. That is why chronic pain exists. You've led to a technological advance, which has led to less activity, less doing of things, less manual. I don't know if you've ever seen kind of like, you now see these advertisements for Amazon. You see the person standing there, and they're looking at the robot moving all the boxes around. The person just stands there and looks at the computer screen or looks at the robot and sees the robot moving everything around. Well, I hate to tell you, when I was a teenager, I was a stop boy. And I had to go up and down these stairs and take stuff out, reach and take pieces of equipment out and put them into boxes and tape the boxes up and lift the box and put it somewhere. Who do you think has a greater chance of being more physical and having a better chance of functioning versus the person whose muscles are weakening, declining, atrophying, and now are more susceptible to eliciting pain anytime they try to do something? I want to make this, and this is a bold statement to make. Chronic pain is not a medical issue. It is a societal issue.
Sure, absolutely.
So,
and you can see it. You can see it based on every bit of information, the number of people, the type of things that bring it on. It is societal. Chronic pain never existed in the history of mankind.
Yeah, so it's a thing where you have it, so you have to use it, and if you're not using it, well, this is what's going to happen, you know.
So, if you really want to understand to a higher level, you talk about the International Space Station. If you look at astronauts, they're the greatest conditioned people in the world. They are conditioned severely. They take years to develop their conditioning. What's the number one fear going to the International Space Station? It's what? Loss of muscle mass. Why do they so fearful of loss of muscle mass? It's no gravity.
Yeah.
You don't have gravity. You don't have to push against anything to function. When you don't use it against gravity, when there's no gravity, you lose muscle mass. And through all their attempts to sustain muscle mass, nobody comes back without some level of muscle mass. What is the difference between that and being on Earth with gravity and not standing up, walking, going upstairs and all that, and simply just sitting in a lounger, recliner, looking at your laptop or your cell phone? You're literally doing the equivalent of putting yourself at the International Space Station. So of course you're going to weaken and lose muscle mass.
Yeah. And that's why people, like you said, people do get weak and stuff like that, because if you're sitting in front of the TV all day, you're sitting in front, and that's one of the,
or the computer,
not
getting up and moving around for at least 5 minutes,
an
hour, and you know, hey, I've been sitting for an hour. Get up, move.
Yeah.
I mean, just think about what's the number one profession, the biggest profession in the world. It's IT. It's not even close. People sit at their desk for 8, 10 hours a day, and all they're doing, I mean, I'm not diminishing the value of information technology.
No.
It's wonderful. It's great. All I'm saying is that you make sure that you read or do things to stimulate your brain. You make sure you try to take in nutrients, but for the average person, the body, your musculoskeletal system is basically there just when you need it. And if it doesn't work out, I'll just go to a doctor and think the doctor's going to fix it. It doesn't fix it. It doesn't. No one can make you stronger. Only you can make you stronger.
Absolutely.
Yeah. So let's look back as what you're saying. Let's look back at the history of man, because the history of man, you had the man came, and then man had to go out and hunt. He had to walk every day. He had to go out and find his food and kill his food, or he had to get
Origin hunt.
Yeah, origin hunt, or he had to get, his plants or whatever to eat, But he was up, he was working because he was doing all this for survival. Then we go a little bit farther, and we got the farmer, and then we got, now we have, like you said, the information technology where people are at their desk and people aren't moving, and if they want to eat, they can go to the store, they can grab it, they can come home, they can cook it, and they sit there. Yeah, or like our kids grab one of the food apps and order it like that, so you're not moving. And that's one of the things we're trying to tell our kids is like, get up. We've had to take the internet box away because we was like, get out of the house, go walk somewhere, just get out, go do something.
You got a good 30, 40 years now. Childhood obesity never existed in mankind. Never existed in mankind. Now it exists. Why? Because when I was a kid and I wanted after school and I wanted to pretend to be John Elway, I went out and I played football and pretended to be John Elway. Yeah. The kid today, he puts on Madden 97 or Madden 21 or whatever it is, and he plays with his little finger and thinks he's John Madden. Thinks he's John Elway. That's the problem. This is cultural. Yeah. This is a cultural shift that is basically there is a general premise now that the reason that man survived was because of the premise of survival of the fittest.
Yeah.
As you go generation to generation, you get mutations to genes, and as a result of survival of the fittest, those mutations are varied back so that you're constantly making things better and better and better. Yeah. At this point, there is a general premise thought scientifically that survival of the fittest is over. It's done. It doesn't exist anymore. Mm-hmm. It doesn't exist because now it's no longer an issue of physical capacity to survive. I just have to, like you said, call DoorDash up and I can get anything I want.
Mm-hmm. And that's the thing too, because a few years ago, a friend of mine, he lives in Colorado now, but he came back and we went to the old neighborhood, and we're driving around the old neighborhood, and we're like, where are the kids at? Remember we used to play baseball here? You remember we used to play kickball here? You remember? And it was like a ghost town,
Yeah, it's really sad, and it's very hard. When I talk like this, the average person says this guy's insane. He's just some lone wolf out there. All I ever want people to, first off, I want people to understand, if you think that the medical system is always right and that it's always linear, it's never a step back to the side or back, let me make sure you understand this. George Washington was killed by his doctors. Most people don't know this story, but this is irrefutably true. George Washington had retired. He's just riding around looking at his acres, and all of a sudden he comes home one day and he ends up with pneumonia. At the time, the highest level medical technology and thought process is if someone has infection, you bleed them, yes, causing the blood to come out, hopefully removing the infection. So they bleed George Washington at his neck. It led to an inflammatory response, and over the next 24 to 48 hours, George Washington suffocated to death. Mm-hmm. Those tools are in the Smithsonian Institute. So is someone going to tell me that George Washington didn't have the best doctors with the highest level of technology of the time? You're saying that he had crappy care? Of course he had the highest level technology. So it shows, how about the 1920s or 30s? If you had a behavioral problem, they took a pick, stick it through your eye, and you had a lobotomy. Mm-hmm. Oh, wait a second. That turned out to not to be such a good idea. But at the time, you know how many people? Hundreds of thousands of people got lobotomies and were left to be vegetables, right?
Yeah.
So advancement doesn't always mean correct. And you have 40 years of empirical evidence of the use of the MRI, and there is no theoretical, clinical, or scientific evidence to justify that it is working. If it's working, why is it that for 40 years, the number of people suffering from chronic pain has not gone down 1 year? Not once. Never. Mm-hmm. That's the problem.
Mm-hmm.
Well, I think people need to understand that they put their bodies in this stance. Even me, myself, they go into a gym or they go to the doctors or they go to the physical therapist and they're like, okay, I went once. I expect changes. And if you put your body in this stance, it's going to take time to get back into that healing stance. You're not going to get it the first time. You're not going to get it the second time. You're going to get it when you start putting in that work.
Absolutely. And that, you know, the problems lie in the fact so the person goes to, let's say the person does go for physical therapy, and let me just make it clear. Although I have a doctorate in physical therapy, everything I do is based on a self-derived understanding in terms of I took a high school physics course and I applied physics laws to weightlifting, force vectors, fulcrum arms, levers, and all this stuff. That's what allowed me. I put 60 pounds of muscle on myself, and I've used that methodology to treat these people over these 28 years. But even within, let's say you're diagnosed in your lower back with a herniated disc, or at the shoulder, or knee or hip with arthritis, and they say, okay, we want you to go for physical therapy. Don't you think that the person's mindset is that, well, you said it's arthritis or a herniated disc. What's the physical therapy going to do to make me not have arthritis or a herniated disc? So I'm kind of going into this with this attitude of, I don't really even think this is going to work.
Right.
And of course, based on that diagnosis, it wouldn't work, because what could anything be done to arthritis or unherniate or herniation? It needs surgery, right?
And
so
that's the same with diabetes. Why should I change my diet now?
Right.
Yeah.
Right. So they go into with the attitude they really didn't think it was going to work. So are they going to give their optimal effort? Of course not. If you, as you just put it clearly, you get out of something what you put into it. So if you don't put anything into it, of course you don't get anything out of it. So you see it as a failure.
Yeah.
And the more times you try different things and they fail, because they were going to fail from the very beginning, because you're not basing the treatment on the true cause, then the person's mindset begins to move to, oh my God, I don't think I'm ever going to get out of it. This may be my life. And so anxiety and hopelessness develops, depression develops, and for a pretty substantial amount of people, suicidal thoughts develop.
Yes, very true.
And it's not about the pain, and that's what everyone has to understand. It's not a direct result of the pain. It's a direct result of the fear that I will not resolve the pain.
Yeah.
That's where it comes from.
Well, Dr. Yass, it's been a great conversation. Had a good time. Learned a lot. If there's some way or any way somebody wants to get hold of you, is you got a website or something you want to tell us?
Text it to me so I can put it in the link.
Sure. So the website is livewithoutpains.com. It's plural, livewithoutpains.com. And the great news there is that I treat in person in Jacksonville, Florida, but I've been doing virtual sessions for 6, 7, 8 years now. So on the website, livewithoutpains.com/sessions, you can schedule a Yass Method Zoom session, and we treat you through Zoom. All you need is a chair and a resistance band. The session's a videotape, so you have that going forward. And basically, we take you from where you are to full function and pain-free. So you can do it that way, or if you just want to have a question answered or look further into this, you can contact me by email at drmitch@mitchellyass.com. It's drmitch@mitchellyass.com.
And that will definitely be in the link when we post it. So people out there listening, if you want to find out more about Dr. Yass, look at the link. Look at the link wherever you get your podcasts, wherever you're listening to this. So I'm going to let Rach close us out. And Dr. Yass, thanks a lot. Definitely would love to have you on, talk some more. But this has actually been very interesting.
I appreciate it. I'm always willing to come back. This is a lot of information. It's a lot for the person to take in and saturate quickly. So, you know, they always talk about, for someone to really get to understand something, they kind of got to get hit over the head a good 5, 6 times. So I'm ready and willing to come back 5, 6 more times, man. Never bothers me. I love to spread the gospel.
Oh, yeah. All right.
Hey, guys, if you appreciated what you heard, thank you for that. And keep on listening. We got more for you. On here, we're building lines of love and trying to make you guys your best advocate. Until next time, have a great one.
Thank you.